Oh, thank you, Anna, and thank you, Jenny. Some brilliant, brilliant presentations. And as Anna has introduced, I'm Caitlin, and I'm a consultant midwife, and I work in Worcestershire, implementing continuity of care, and continuity of care being something very dear to my heart, having done this when we had our first iterations back with the changing childbirth presentations and iterations. So very, very dear to my heart, and it's a real pleasure to be sitting on this side of the coin, so to speak, in trying to implement continuity of care both in practice and in universities. So the title is very long. I'm currently the chair of the subgroup of the expert reference group for continuity of care with NHS England. Thankfully, they don't require business cards or ID cards because that would be a challenge for anyone to take on. But I'm here today representing that and representing the group to really give you an update on where we are here in England to try and implement some of the things that Jenny has been talking about and Anna's been talking about. So just to let you know that this is work in progress, but to give you an update on really where we are and why we are where we're at. So why was the education group set up? This was asked for by NHS England committee that was working on continuity of care, the expert reference group, to really start to look at the foundations of midwifery education and how we can start to embed this in our education systems and moving forward as continuity of care starts to become the default model as described in 2023. So we really have an opportunity in our education system to drive forward some of this transformation and embed it and really look at the relational model of care and flipping some of what we've traditionally done on its head and really driving this forward, as we said. So domain 2, as we know, our new standards are out and most universities are in the process of adopting this. But domain 2 really looking at how clinicians and students and future midwives embrace continuity of care. So it's really centralizing around that. And all of the other domains will really shake out of continuity of care. So if we get this domain right, and if we start to embed this within our curriculum, really all of those other domains will by proxy just shake out. Of course, we've got the long-term plan and 5 times more, which is also feeding into some of the reasons why continuity of care is really so important for women birthing people and our families. And a new document just released last Thursday from NHS England, which is looking at continuity of care as our default model, moving into 2023 and certainly having some of those building blocks. And that is appreciating, of course, the current climate that we're in as we start to hopefully, she says, move out of the COVID pandemic and into something different on the other side of that. But we've also got to take stock in how we're all feeling, and certainly, as Anna alluded to in her presentation, around the burnout and around how staff are feeling around this, but also that continuity of care is a little bit of our hope in the sunshine of the future of what midwifery might look like. And of course, we've had our better births, which has been driving this forward and really creating those building blocks of joining up education and practice together and looking at the current context of which we're in. And that's really how we got to be where we're at. So what we're doing, so we really want to build a toolkit or a resource package to really enable COC experiences for student midwives and their mentors and their supervisors, using the new language, my apologies, supervisors and practice assessors out there, and really giving some practical tools. And we really wanted this to be where student experiences are embedded in philosophy of continuity of care, because continuity of care is a philosophy of care. It's not just a model of care, it's a philosophy of care. It's a philosophy of working with women, birthing people and families, and understanding the relational based model is actually one of those interventions that we have that can improve health and outcomes. And I think, Jenny, your work is certainly demonstrating that as students, the power that students have to even make a difference within that. And often students say, I'm just a student, but I think your work really says that's not true. You are a powerful intervention along this journey as well. And so it's really getting that relational model based into the midwifery curriculum. And we wanted best practice examples for sharing and learning. And this was really that we wanted it to be a collaborative of a platform where people could access, where students could access, assessors could access, institutions could access, anyone can access, birthing people and families could access a platform where there were examples of student learning across our entire curriculum and across England for sharing and discussing and disseminating and really using to help everybody learn together about where we're headed with midwifery education. And we wanted all students, supervisors, and of course our service user voices to be absolutely central to this. So all of our stakeholders involved are starting to drive this forward and bringing lots of discussions to the table. We had a meeting just this afternoon, and having those debates and those discussions about how to drive this forward has been just nothing left of just amazing of what the work is going on. And this is a collaboration across England. So there are people spread out throughout, and Teams has been an absolute lifesaver for all of this, because we are able to get together across England to really start to drive this forward. And we wanted it to be a dynamic interface. We really want this to be something that can be updated as new evidence and new information, new best practice tools start to become available. So we really wanted this to be driven by those who are going to be using it and who are going to be accessing it. So really, where are we headed next? So we want the ability for everybody to be able to share their challenges as well as their successes. And it is about being honest about our current context of where we are and where we're at and how people are feeling. And those will create some challenges in our practice placement areas with our supervisors and our assessors, and within our universities. And I think it's embracing those challenges and working through them and finding out how other organizations have perhaps faced these challenges, maybe something slightly differently, and how those have been worked through, but certainly embracing the current context, the current political context as well of our midwifery practice. And we're also discussing getting together to look at local experiences and collaborating together on this to share best practice learning and what those experiences are like, to create a really strong voice about what it means to be a student in continuity of care, whether or not you have actually experienced a continuity of care team, or whether you've had a case loading experience, or whether that is the philosophy that has been built through your curriculum. It's about joining those evaluations together. And also the group, of course, is then looking at how newly qualified midwives, as we move forward in continuity of care, and perhaps replicating something along the lines of this toolkit for our newly qualified midwives who are moving out into continuity of care, and a little bit about that transition from student into qualified workforce and what that might look like in the future. And we'd like this to be hosted, and it will be hosted within the NHSE toolkit site, which I think most people have access to on a regular basis. It's a free access site, and we're hoping to put it there with all the other tools and staffing tools. So it's really, really, really easy access for everybody to get to, and it can be a dynamic tool, which is the key thing. And of course, I've put there that we need you, and we'd love to hear from anybody who has been experiencing continuity out there, or any of our educators out there who are embedding continuity of care. I know there's all sorts of great stories out there, and we want them to be shared, of course, going through your university and all of their processes for sharing things. But if you want to, please do get in touch with us, and you can get to us via Anna's team here at the Midwifery Hour. And I just wanted to say a big thank you to the Continuity of Care Education subgroup. We are growing by the minute, and more voices are being added to it, which I can't think is brilliant. It's just absolutely fantastic. And for their contributions and enthusiasm, and of course to all of the future midwives, because we're doing this for you. And thank you very much.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.